We will call the Tuesday, October 28th, Steele County Board of Commissioners meeting to order. Please stand with me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, so I will look to approve the agenda with the addition, right at the general agenda on a marijuana, cannabis use, and then at 18A, designate Steele County engineer.
Mr. Chair, I'll move the approval of the agenda with those two changes.
Do I hear a second?
Second.
Motion's been made and seconded to approve the agenda with the two additions. All those in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. That will take us to public comment. Those wishing to speak will state their name and address for the record. After they are acknowledged by the board chair, each person will be limited to 2 minutes to make his or her remarks. Steele County is committed to respectful behavior in its work environment and in its boardroom. Speakers should show dignity and respect towards others. Speakers will address all comments to the board as a whole and not one individual commissioner, and will not make comments about any elected or appointed officials or staff. The board may not take action on an item presented during the public comment period unless the item is already on the agenda for action. When appropriate, the board may refer inquiries and items brought up during the public comment period to the county administrator for follow-up. Comments from speakers may be curtailed by the board chair if the speaker is argumentative, disrespectful, redundant, or repetitive. There will be no name-calling or abusive language permitted. Disrespectful behavior will result in being asked to return to his or her seat or leave the boardroom. With that, I will open it up for any public comment. Any public comment? Go one twice. Go 3 times. Public comment is closed. That will take us to correspondence.
No correspondence this evening.
Next up is our consent agenda. Board's wishes.
Mr. Chair, I'll make a motion we approve the consent agenda as printed.
I'll second.
Motion's been made and seconded to approve the consent agenda as printed. Any discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. That will take us to 15A. Ethan.
So while he's proceeding, I'll give you a quick background. As you recall, the board was asked to adopt an ordinance with regard to the retail sale of adult hemp products, with the cannabinoids that are out there and were recently legalized. And the state is progressing through the licensing process and whatnot. But the low potency products, so the hemp-based beverages, the gummies, that sort of thing, that are currently available in retail establishments weren't covered by that initial adult use ordinance. And within the last couple of months, the state is now moving towards this idea of licensing now these low potency hemp retailers, which then presented the question to staff, does Ordinance 42 adequately cover the low potency products? And more importantly, do we want to apply the same standards when it comes to setbacks, for example, for the low potency products? And some of you were in attendance at a recent public safety and health meeting where the results of some research presented a real interesting dilemma in terms of the access and availability to our youth when it came to the low potency hemp products. And then it also raises the question then of, are those setbacks necessary to protect youth? Does it present a business hardship? How do we want to proceed? So staff did meet with our counterparts from Blooming, Owatonna, and talked through some different scenarios in terms of how this might play out. And right now, Owatonna is in the process of also considering some modifications to its ordinance with regard to low potency hemp. And I think the consensus of the staff was to try to go in parallel, much like we did with the original ordinance. So It was presented to the Owatonna City Council last Tuesday with their first reading. It will be coming back to them for a second reading in 2 weeks, but they're looking for kind of our board's direction in terms of what we want to do. And so this is not before you this evening for a decision, but rather we're looking for guidance from the board as to whether you are in support of the recommendations that Ethan's going to be mapping out here for you. And if so, we would then bring this back to the board for a public hearing at your November 13th meeting. So I'm going to turn it over to Ethan now to kind of provide the background, but more importantly, lead you through what the staff is recommending.
Good evening. So there's the Pharmacy Practice Act in 2022, which that was the rules for the hemp-derived cannabinoid products. And so those rules are being replaced by Chapter 342 and the lower potency hemp edible products. They're pretty similar classes of products. They have to have less than 5 milligrams of THC per serving, 50 milligrams in a package. There's some additional limits on certain types of cannabinoids, CBN, CBD, a lot of different acronyms, as well as allowing Delta-9 as an artificially derived, and also adding in local registration, local compliance checks. So those are kind of the changes between the old rules and the new rules. The old rules didn't have any really local processes as far as allowing those retailers to sell. That all went through Minnesota Department of Health back when they were in charge of cannabis stuff, and now OCM. And so what the Office of Cannabis Management is requiring of these currently selling retailers and the HDCP retailers was to register with OCM by August 31st. And that qualifies them to continue selling these products without disruption during this application window, and then to convert their registration to a license if they so choose. And so the application window for lower potency hemp edible retailers is this month, October 1st to 31st, and then the OCM will be rolling out those application approvals throughout the end of the year. And so during this month, these registered retailers who have been selling these products can convert their registration. It's also an opportunity for any retailers who have not sold these products before to apply for a license to start selling. So we the list of retailers that have registered by August 31st is made publicly available. For Steele County, there are 43 registrations. It's really 38 once we remove businesses that have closed since they registered, and there are a couple of duplicates. 10 of those 38, I think it was 6 or 7 of them are at one address, and there's a few in residential addresses. As they're listed, they're most likely online distributors, which is a separate provision in the ordinance that would ban those online sales because the local compliance checks there's not really a great way for our law enforcement to make sure those websites aren't selling to people under the age of 21. So we're really looking at 28 brick and mortar retailer establishments that have registered with OCM with the intent to convert their license or convert their registration to a license. And so our first approach, we were looking at, just to stay consistent with adult use, have those same setbacks. The issue with that, see on, there we go, the one that says impact of the proposed buffer zones. If we were to apply all the same setbacks as we have for the adult use, only 2 of the 28 retailers that are currently selling these products would be able to stay open. And we felt that, that would be a lot of pushback and, just not really be supportive of local businesses. But we still
stay open. You mean not sell?
Sorry. They would not be able to sell the products, they would be able to stay open. And then, so we looked at different, combinations, if we reduce setbacks and just got really complicated. So that for adult use, we're having these setbacks, lower potency, these setbacks. So we kind of scrapped all of that and looked at, 21 plus stores, that's your liquor stores and tobacco vape shops. And then any retailer that has an on-sale liquor license, they have a bar, they have the safeguards in place that they're only serving to people over the age of 21. And even for adults, they're not going to accidentally consume these products. Like they go to a gas station and grab something off the shelf that, might be right next to a seltzer water, but it's actually a cannabis drink. So we felt that going with the 21 plus and the on-sale liquor license for our existing businesses kind of struck that balance between protecting youth and families and still supporting local businesses. And so this kind of Excel spreadsheet, small text, but kind of shows the impact of what this ordinance amendment would do. So at the top, there's the 14 in red. Fairway is the weird exception. We're not quite sure if their registration applies to the grocery store as a whole, just to the grocery part, or just to the liquor store. So that's why that one's highlighted yellow. But assuming that it is for the grocery store, it would be those convenience stores, the 3 grocery stores listed, and then the GNC supplement store that would no longer be able to sell the lower potency products. The 10 gray in the middle, those are those online stores. And then the green toward the bottom, so those are the 10 retailers that are 21 plus only. So the liquor stores and smoke shops, and then the 4 at the bottom are the retailers that register that have, a bar counter and on-sale liquor license that would still be able to sell these products. So as the ordinance amendment is drafted, the existing businesses who have registered by August 31st would have kind of a one-time exception to the buffer restrictions, the setbacks in the ordinance. Any new businesses would still have to follow those restrictions. And whether they're an existing business or a new business, they would have to be a 21 plus store or have an on-sale license.
Can you say that again? So we're talking about the 14 that are the 21 plus?
Yep.
Okay, so they have a period of time when they can register?
Yeah, so they have everyone on this list has registered with OCM already. So those 14 at the bottom would be able to sell since they're 21 plus and or have an on-sale rate there, right?
Okay.
Yep. If a new store wanted to open up, JV Liquor wanted to start selling these products, they would have to comply with the setbacks as well as the 21 plus or liquor license. So that stays consistent for any new cannabis, whether it's lower potency or adult use. Any new stores would have to follow the setbacks, and the adult use stores already are supposed to be 21 plus anyway. So that.
And this is a proposal, correct?
Proposal.
They don't have to do
this. This is the proposed language. So that's kind of the complicated part of the proposed amendment. The remaining of the additions we made were to align either with state statute or with our tobacco retailer ordinance. So it's just kind of, I guess that's not right here. So looking at, age of consumption, age verification, minimum age for clerks that are selling these products, packaging and labeling requirements, and then strengthening the time, place, and manner restrictions. So this would be prohibiting the sale of these products through vending machines, self-service displays, at a movable place of business or by delivery sales, so as to knock out those 10 online stores. And it would also just, prevent them from being in a cooler next to soda or, a non-intoxicating product. Also prohibiting smoking, sampling, on-site consumption, with the exception of the retailers with the on-sale liquor license, and then prohibiting any kind of packaging or products that appeals to you, gummies that look like Sour Patch Kids or something like. So if the board supports this language, these recommended limitations, the ask is for a public hearing, post it in the newspaper, and have a public hearing November 13th.
So you'll have the public hearing November 13th, and then at that time, you'll have everything, all the language that you want. But in the case, I'm sure there's probably something we haven't thought of. Then we can amend it at a later date or not?
Yes, you
I mean,
you can amend any ordinance anytime.
Okay. Because I'm sure there's be something we forgot or missed or
Something's always.
something will come up, yep.
And that's a great point. We're really just trying to take a proactive approach and, do the best we can to, protect youth and families. Kind of saw with the G21 tobacco, vaping, that whole rule where we had to wait until kids were having top of lung and having health problems before upping the age from 18 to 21. So this is a proactive approach where later on, the research shows that it's not as big a deal, it doesn't have as many health impacts as we feared. We could, loosen the restrictions.
And I can speak towards like regulation previously, it was non-existent essentially the last couple of years on these products. It was, in my opinion, a loophole of the state push, starting the cannabis, laws. And so a lot of products were made very quickly. Regulation was minimal at best. So you saw a lot of retailers picking these up. So I don't think it's unreasonable for public health and safety for the board to at least consider reasonable restrictions on this, because the state has not specifically done so. So this is an area in which the board can adopt restrictions.
I think it makes perfect sense, because we heard some horrible stories about kids having lots of issues with getting a hold of some of this stuff and probably shouldn't have.
So, Mr. Chair,
Yes.
so probably oversimplifying this, but really just treating those 14 establishments that want to sell this like they're selling liquor, basically the same concept, right?
Right.
And not applying the setbacks that we will apply going forward.
Right.
Is that how, okay. I just want to make sure I understand it correctly.
There's a grandfather.
Yeah, but it'll have to be behind the counter and go out.
Okay, so we just need a consensus from the board for the November 13th meeting then?
I think that we were looking more if you're absolutely opposed to even having a conversation about the 21 plus limitation, if you just want to let these businesses go wherever, or if you wanted to go stricter, we wanted that guidance from you. But if you're okay with what staff has proposed, that doesn't mean that you're ready to approve it, but if you're willing to allow us to move forward to that public hearing phase, that's really the direction we're looking for from the board this evening.
Well, Mr. Chair, I would say that that would be my feeling on it. Plus, I think that will help be concurrent with the city of Owatonna too. And I think those two have to kind of mirror one another, because ultimately, public health and law enforcement are going to be the ones that have to take care of everything. And I think they have to mirror one another.
I don't think, you said earlier that it'd be behind the counter. I don't think I think the beverage stuff would be in a cooler somewhere, wouldn't it, or not?
It could be in a cooler, but it would not be a self-service. So, I mean, it could be like, in Walmart where they have the cologne locked. It would have to be, an employee would have to get it for the person.
It won't be out in a Diet Coke case like it probably is now.
Right.
I'm not sure it's strict enough, honestly. I mean, I get that we need to grandfather and try and work with some of the establishments, but I'm still not convinced that it's strict enough. I don't think it should be anywhere. That's just my opinion, and I might be wrong, and you could try and convince me otherwise, but I don't I don't think it should be anywhere. The problem is the ship sailed, and
Yes,
these
that was
establishments
left
were allowed
water.
to have it, which makes it difficult.
No, you were at the work concession for the city. Can you maybe summarize the flavor of their conversation?
I think overall their concern is the businesses that would be no longer able to sell these products. It's a lot of corporate, it's Quick Trip, it's Circle K. So kind of some fears, concerns about the potential pushback.
Can I respond to that? I have to believe that there are Quick Trips in lots of communities that don't allow this, and they function just fine. I'm concerned for the business, but I'm also concerned for our youth and our public, and Quick Trip takes a second to that, so I'm not gonna worry a whole lot about that. They're gonna be fine.
When you look at the stores that would no longer be able to sell these products, is, Quick Trip, grocery stores, this is not their primary product. They might take a temporary hit on losses, but in the end, they'll be able to bounce back.
But again, they operate in communities that I'm sure have already put some restrictions in place that it's not allowed. So it shouldn't come as a surprise to them if this board or the county decides to say absolutely not.
Any input, Lon?
I agree with Commissioner Abbey. It's their choice.
So I would say, as far as I'm concerned, yeah, you can, we can schedule for the 13th, but I'm for putting some restrictions on this because we just don't want to have a free-for-all. We want to, be in control of the situation here, so. And then you bring us what you got, and then the board will look at it and see if we got any other ideas.
Well, clearly the committee and everybody who's worked on this has tried to strike a balance between not penalizing the businesses that have already done it, but
At least you're making it a little tougher for them. They can't just go walk out.
Well, yeah, I think you have to control it so that no one underage has a way to get at it.
And that's the biggest concern.
Right.
Have you had any communication with these businesses, that anyone objecting to it, or?
We reached out to the business directly about this.
So they haven't reached out to the county?
Okay? Thank you much.
thank you.
Ethan, are you sticking around for 16 as well?
Yes.
Okay.
Okay, that'll take us to number 15. Authorize staff to draft and send a letter to Mayo, Alina, and the Chamber of Commerce summarizing the board's opinions regarding Mayo's decision to discontinue having babies service.
Labor and delivery.
That's what we call it. That's what we call it at home.
So just a little bit of background for the board. Mayo and Alina have this weird marriage. That is the Owatonna campus that we see over there on I-35 where Mayo operates the clinic. Alina operates the hospital, and about 10 or so years ago, they entered into this very, very detailed, complex agreement of what Mayo was going to do and what Alina was going to do. But there's apparently some language in this arrangement where Mayo can just give Alina notice that it's going to discontinue the provision of certain clinical services or the provision of staffing at the hospital facility. Mayo actually gave that notice to Alina back in September, saying that they were no longer going to provide the OBGYN staffing necessary to support the delivery of babies at the Alina facility there in Owatonna. Alina reached out to Mayo, received a deference of sorts that instead of it being 30 days effective in early October, that Mayo was willing to move that effective date out to November 16th. So effective as of November 17th, Mayo physicians that carry that OB credential and would be, fully trained and authorized to deliver babies and provide emergency C-sections or regular C-sections are the case, that those services will no longer be provided. It is our understanding that Mayo has been actively working with its current patient load at the Owatonna Clinic, letting them know that after that date that they will need to make arrangements for delivery at one of the other Mayo facilities, Austin, Mankato, or Rochester. So Owatonna, the chamber, as well as the city, became aware of all of this about a week and a half ago when a press release was issued. And it was the first press release of any sort to say, oh, by the way, babies will no longer be delivered at the Alina Hospital. And then Alina followed up with their own press release saying, oh, wait, we're more than willing to provide that service, but until we have the appropriate board-certified OBs on our staff to be able to deliver babies, we'll have to defer the patients to other hospitals for some period of time until we work out a deal. So with that, the Owatonna mayor and chamber exec started reaching out to both Mayo and Alina saying this really isn't a good solution for anyone here. We need to have this continuity of service. What are you willing to do? And I was included on an invite to meet with representatives from Alina, and we've actually met with the delegation from Alina twice. The first meeting, Alina was like, yeah, we're willing to do this, but we don't have a plan. We'll need to divert for a period of time. When we met with them the other day, which was on Monday afternoon, they said we are actively looking for the staffing we need. We're hoping to work out an arrangement with Mayo where maybe their physicians can continue to be available for a period of time, but we don't have the details worked out. But we are committed to having a labor and delivery suite in the hospital. We just don't know how long it's going to take to get the appropriate staffing in there. And it's been my message to that team from day one that Steele County, along with clients that are residents of Waseca, Dodge, and other adjacent counties that are clients of our public health, don't have the same choices. They don't have the same transportation options that would be available to a typical Mayo client or Mayo patient, that any kind of deferral or diversion to another hospital is just simply not acceptable as far as the county is concerned. And Amber Oseth, our Director of Public Nursing, Public Health Nursing, was able to let me know that we have 75 women currently on our WIC program, which is women, infants, and children who are pregnant and likely looking to be delivering at the Alina facility here in Owatonna at some point in the next 6 to 8 months, whatever the case might be. Waseca does not have labor and delivery services at their hospital, so we know that there's Waseca clients of their public health programs that are likely to be coming to Alina. The same is true with Dodge. We know that Freeborn is in the same boat. And so we're trying to marshal all of those organizations together to say, you've got a significant number of patients here. I mean, based on the data we've been provided, there are 400 babies born at that hospital every year. So if 75 of them are our clients, and if we have comparable numbers from Dodge, Waseca, or at least proportional numbers based on population, a good number of those 400 babies are clients of Steele County or one of the adjacent counties. So we do have a meeting set up with Mayo leadership on Friday morning, and we're hopeful that there would be some type of a unified response from Mayo and Alina that would provide for the continuity of that service and that there would be no diversion. I reached out to Leota, and because their program is really based on insurance reimbursement, they don't know which of their clients are actually pregnant until after the baby is born. But she was going to try to pull some statistics and some numbers to maybe look, maybe more retrospectively to say, okay, what percentage of those average number of births are coming from kind of our general region. The chamber did generate a letter opposing any kind of diversion and speaking out against this plan. It is contained within your packet. The Owatonna Council similarly adopted a letter expressing support for Alina's effort to resume or maintain these services, but in opposition to any kind of discontinuance. And so I'm here before the board to find out whether the board wants to generate some type of a response in writing, and then if so, staff would prepare that and send it off on your behalf. I have nothing in writing for you at this point because I really had no idea what direction we would go with this. I can say that Amber and her team are very much concerned about what this means for her clients, many of whom are not comfortable coming forward early on in their pregnancies, have severe distrust of the systems and what their options might be. And I flat out asked Alina, if a woman shows up in full on, you know, she's dilated to whatever number, shows up in the emergency room, what are you gonna do with her? And they made it real clear that until they actually have a board-certified OB on staff, available on call, or whatever the case might be, that patient will be sent elsewhere. And I said, if you're in full-blown labor, how reasonable or practical is that? And again, are you planning to pay for the hospital or the ambulance ride to that alternate facility? Because I don't know what medical assistance will cover, and I don't know what their transportation options might be at that point. So I think after the second meeting with Alina, they are hopefully more aware today than they were yesterday in terms of the level of concern that we as staff have in terms of the impact that it would have for our patients, our clients.
No, I'm all for it, because more than one baby being born a day, I can't imagine having to drive an hour. It just ain't gonna happen for a lot of people.
I don't know. Well, and she just alluded to it, if we have 75 in our public health system that are pregnant, and those are people that don't have the funding they're already on assistance of some kind, and all of a sudden they're gonna get out there and they say, well, you're gonna have to go to Faribault, or you're gonna have to go to Mankato, or wherever. They can't afford an ambulance, right on top of everything else. They can't even afford the doctor's visit, for crying out loud. And so there's gotta be something done, and I'm fully in favor of putting some sort of a letter together to state the fact that these guys gotta work this out.
We need to have some unified approach, joining the chamber, city. I don't understand how a town or a county of 40,000 people can't have babies delivered. This doesn't seem right.
So would the board prefer a resolution, or is a letter similar to what the city of Owatonna put together, a format that you would support? And if so, what are kind of the key messages that you would like to see in that letter or alternate method?
Mr. Chair,
Yes.
I think that part of the message should be that how it puts our expectant mothers and infants at risk. I believe there are stats out there that would support that. Not having a facility nearby contributes with all kinds of issues. So that should be part of the tone of the message. And I agree with Josh that, you know, a county our size, it's embarrassing that we can't have a facility that can deliver babies. So
We're talking about cutting services and.
in a growing community.
Yeah, it doesn't make any sense.
And I think that as part of the county's letter, because we are in charge of human services and public health, I think that should be an aspect of the letter, that we are dealing with people that don't, a lot of people that don't have traditional insurance. That they do get some assistance of some kind, and it's even a bigger burden on them than it is on someone with the income and the wherewithal to drive to Mankato or Rochester or wherever they deem, you know, if it's Mayo, it will be Mankato or Rochester or Austin. And if it's Alina, it's probably going to be Faribault. But I just think that needs to be part of it, because I think it's a reflection on the county's position, because we look at it a little bit differently than the city or the chamber do.
Any other direction?
So for next steps, what I can do is put a draft together, and are you okay with me just emailing it out to you and soliciting your feedback? I would send it out as a blind copy so that you don't reply all.
Yep.
Gather that input, and then that way if we can reach consensus on the verbiage, we can get that out sooner rather than later. If the board needs further discussion, then we just bring it back to your next meeting.
I think it would be great if you did that, and I do like the idea that everybody signs it, and we can all come up here and sign it whenever you tell us to have it done.
You need a motion for that?
I think if there'd be a motion, it would be direct staff to draft a letter for board consideration confirming your opposition to the potential diversion of services to other hospitals.
I'll make that motion. I'll second.
Motion's been made and seconded. Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries.
Thank you.
Number 16, approve a $200,000 award ceiling for the 2026 opioid response initiative awards.
So, as you may remember, we started last year with our opioid response initiative, doing a request for proposals into the community. Last year we received 94,527 requests, awarded 67,500. This year, and last year there was a $100,000 funding ceiling set for the award. This year, we kind of flipped the process around a little, where we solicited the proposals first and then now are coming to ask for a funding ceiling. This year we received significantly more in requests, about 224,000. Overall, for proposals we received, all fall within the guidelines of the award. And with a current balance of around 525,000 in our opioid settlement fund, we thought that with the amount we received and that balance, that we could award up to $200,000. Based on your decision tonight, then our staff would then conduct an in-depth review of the proposals, come up with an exact number of what we would award to each recipient, and bring that to the board at a later date for approval. But today is just to set that maximum amount that public health could recommend to award across the board proposals.
Before we have any discussion, I've got one quick question for the county attorney. Me and Commissioner Brock back on one of the boards of these, so.
You're asking to abstain, I mean, or?
Yeah, so should we abstain, or that's what I'm asking?
Today is not asking for a correct award, it's setting a ceiling, so I don't believe that you have any conflict on setting a ceiling.
So you see no conflict of interest?
Not for the ceiling, but on the direct.
Okay.
On the direct vote?
Okay.
Yeah, that I would have recommended abstaining
Okay,
from.
gotcha.
But, yeah, I mean, there's also still a drug court, which is tied to our county's budget too, so we're all tied to some of these projects. And as far as, actually, I was at a meeting regarding more, there's another lawsuit or a bankruptcy proceeding with one of the plaintiffs, so there's actually going to be more money potentially coming through the coming years, separate to the owners, the actual family that owned. So they're not just company money, but their own private money that they're in bankruptcy on, so.
Kind of, I think, glazed over that. Yeah, we're expected to receive 90,000 additional annually through 2032, and about 50,000 annually from 2033 to 2038. But that is without the additional settlements that are still being flushed out in court and settled on.
Mr. Chair, I just have a comment on one of them. I'm not involved with that, but under Sparrow's second request, funding the participation in Steele County Drug Court, I don't quite understand.
I haven't reviewed them in depth yet, but I believe that they have a staff member that previously drug court had paid for their time to be at drug court, kind of a warm handoff. But drug court no longer has that funding available, so it would be to.
Okay, it just looked a little weird with drug court asking for money and Sparrow asking for drug court money.
Yeah.
And the funding to aid patients with car repair gas cards and bus tokens.
Right, and that'll be part of the in-depth review where we kind of parse that out and figure out, what do we
Things are
actually
getting a
want
little
to
broad there, in my mind.
Yeah, $200,000 ceiling isn't, we're gonna try to get up to there, that's the max we can go, and we'll see where we might only land at 2020 or 30,000.
Yeah, otherwise, Mr. Chair, I would move the approval of the $200,000 ceiling for the 2026 opioid response initiative awards.
Second.
Motion by Krieger and seconded for the staff to recommend a $200,000 award ceiling for the 2026 opioid response initiative. Any further discussion? If not, all those in favor signify by saying aye. Aye. Opposed, same sign. Motion carries. Thank you.
Thanks, Ethan.
Number 17, adopt resolution 2025-044.
Good evening, Commissioners. For the last several months, Administrator Brian and I have been meeting and negotiating with the 7 unions that represent our various employees. We have reached tentative agreement with 2 of the unions, and those union members have voted to ratify their contracts. So tonight I bring before you 2 resolutions to adopt to finalize that negotiation and contract process. The first resolution I bring before you is 2025-044, and that is to approve the 2026 through 2028 contract with AFSCME for our probation officers unit. You can see in the cover sheet that we have negotiated cost of living adjustments for January 1st of each of the 3 years of the contract. We will be expanding the Christmas Eve holiday to be a full holiday, all days of the week. Right now, it's a half a holiday if it falls on Friday, Saturday, or Sunday. And we will be splitting the cost of the Minnesota paid leave premium. So those are the substantial changes to that contract.
Any questions? Board's wishes?
Mr. Chair, I'll offer the resolution to approve the 2026 through 2028 AFSCME probation officers unit collective bargaining agreement as presented.
I will second that.
Motion's been made and seconded. Any further discussion? If not, all those in favor signify by saying aye. Aye. Opposed, same sign. Motion carries. That'll take us to 2018, resolution 2025-045 with the courthouse unit.
Correct. The second resolution I bring before you tonight is also with AFSCME, and this is for our courthouse unit. That's our biggest bargaining unit in the county. Their list of changes is a little bit longer, as you can imagine. It's a large group that represents a lot of departments, and they have different priorities. So this is also a 3-year agreement from January 1st of 2026 through December 31st of 2028. Again, cost of living adjustments effective January 1st of each year of the contract. Bargaining unit members will convert from sick and vacation accruals to PTO. Christmas Eve will be recognized as a full holiday when it falls on Friday, Saturday, or Sunday. Employer life insurance will be increased. Right now, life insurance is either a $10,000 policy or a $25,000 policy based on an employee's length of service. So now all bargaining unit members will have a $50,000 life insurance policy. We will cost share 50/50 the premium of Minnesota paid leave. And then we will also move the MOU regarding needing to have a satisfactory performance review to receive a step increase into the body of the contract. And the last item of note is we are removing the language that employees who drive their own vehicle for more than 750 miles in a year receive additional 15 cents per mile, so we're striking that out of the contract.
Okay.
Mr. Chair, I'll make a motion to approve the 26 to 28 ASME courthouse unit collective bargaining agreement.
Second.
Motion been made and seconded. Any discussion? If not, all those in favor signify by saying aye.
Aye.
Pose same sign. Motion carries.
Thank you.
Thank you. Regina.
2 down, 5 to go.
I'll be back next meeting with one more.
All right.
Okay,
Good.
that'll take us to 18A, to designate our new Steele County engineer.
So as the board is aware, there's a weird statutory provision that says in order for the county to be eligible for state aid money, we have to have a qualifying county engineer as a full-time employee of the county, and they have to have their PE credential recognized by the state of Minnesota. We were fortunate that when we hired Ron Gaines as our public works director, he held the PE credential, but it was with the state of Iowa. He has now since re-registered and now been recognized as holding that license through the state of Minnesota. And in order to tee up projects for 2026 that are state aid eligible, we recommend that the board designate Ron as our county engineer for state aid highway purposes. And then we will continue to search for a staff engineer who potentially might have that same credential, and then we could have a conversation at that time as to whether we would shift the designation to that individual or leave it with Ron. So before you is the resolution appointing Ron Gaines as the Steele County engineer for state aid purposes.
Mr. Chair, I will offer that resolution.
Second.
Resolution's been offered and seconded to appoint Ronald Gaines as the Steele County engineer. Any discussion?
I have a question. I know before we appoint the engineer, we have a 4-year.
We have the luxury of appointing for the first year, a 1-year term, and then I think we determined that we'll have to do this again in May because of the fact that these appointments run on this weird sort of calendar basis. So we would bring it forward at that time if we have not hired a staff engineer to whom we would want to assign this designation. We would bring back a resolution appointing Ron for 4 years, and that can always then be changed or altered in the future as we may deem appropriate.
Okay. Any further questions? With that, I will call the question. All those in favor signify by saying aye.
Aye.
Pose same sign. Motion carries. Thank you, Ron. Informational items. Public Works Committee minutes are in your packet on page 108. Public Safety and Health Committee minutes are in the packet on page 110. I'll take us to commissioner reports. Mr. Krieger.
I got another report.
No reports, okay.
Okay, on the 21st, I had Midbury Joint Powers Board. I attended and took advantage of the drive-through flu clinic down here on the 23rd, and I will say that they are so organized on that thing. It just bing, 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 and you're done, and on you go. It just works out so slick. And on the 27th, I attended the District 9 meeting in Winona. I will say I was really happy with the way Steele County sounded compared to a lot of the other counties. Our preliminary levy is the lowest of all of them, and I don't sing that because we're not funding things properly. I think we're watching the dollars a lot closer than some of them, and finance people are doing a really good job. And it was interesting. The federal thing was a topic of conversation, and I'll just leave it at that. I don't know what it was. And but otherwise, the priorities for AMC are bonding. Renee, bonding was one of them.
Oh, the priorities, so mental health,
Mental health was the big one.
basically the technology.
Technology is so far behind that, and Minnesota seems to refuse to look at what other states are doing. They kind of want to keep trying to reinvent the wheel, and they still haven't got around And solid waste was another one that they want to take a harder look at. But it was a really good meeting, so.
Thank you for that report, Commissioner Krieger. Commissioner Abbey?
Right, on the 21st, I attended the Mid Prairie Joint Powers Board meeting, also on the 21st, the Public Health and Safety Committee meeting, and on the 23rd, sat in on the OPED meeting, which was very good information.
Well, I also did that one too, so sorry, forgot that.
Commissioner Brockman? Wait, Renee, you have anything to add?
Just two things. The OPEB meeting that our two commissioners attended was focusing on Riverland's efforts to really increase the use of their Owatonna campus to get more students here, to get more programs here. OPEB has really been pushing Riverland's leadership to be more focused on the business needs of our community. They're obviously more committed to making it a sustainable campus. So we're just trying to find that balance between programming that makes the campus sustainable and individual courses and training programs that can be customized to the needs of our employers. Obviously, we approved 2 of the agreements. We've got a third where it went to the vote, and that's the one that Gina mentioned will come back to the board at your next regular meeting. We had a really good meeting with the deputies today. This is the first time that we had the conversation about creating that new senior deputy position. Overall, I think we're really close. We had to summarize a few things, and they'll take it to vote here in the next couple of weeks. So hopefully by your second meeting in November, we'll have that one. So I think the snowball is starting to gain some momentum on labor negotiations. So I'm kind of happy that we're seeing the light at the end of the tunnel on that one.
There was one county yesterday, that was a question that was asked. And one county deals with 13 unions and they haven't even started yet.
Commissioner Brockman?
On the 15th, I had the Spirit Board, and the 28th, county work session.
Okay. Commissioner Glenn?
I attended the historical center meeting and the Rice Steele County Extension meeting very well.
Okay. On the 15th, I had a Spiro meeting and a Soil Water Conservation District meeting. On the 22nd, I attended the Rice County 4-H Extension meeting, and that takes us to today. With that, I got some next upcoming meeting notices. We have the budget work session Monday, November 3rd at 8 o'clock in the annex across the road. Internal Central Services, Tuesday, November 4th, 8 a.m. in the ballroom. Property and Maintenance Committee, Thursday, November 6th, 8 o'clock in the boardroom. Public Works Committee, Monday, November 10th, 10 o'clock at the Public Works Facility. We got the County Fair Board Annual Meeting, Wednesday, November 12th at 11:30 at the Administration Center, Conference 40. Land Use and Records, Thursday, November 13th at 8 o'clock in the boardroom. Next County Board Work Session will be Thursday, November 13th at 3 p.m. in the boardroom. Next county meeting will be Thursday, November 13th at 5 o'clock in the boardroom. With that,
Mr. Chair, if I could just bring up one thing before we go into closed session. Today is National First Responders Day, and I would like to call out all the first responders and that are in and around Steele County and thank them for all the work they do for everybody. So.
thank you for that. And I would like to thank everybody for coming. Before we go into closed session, for the purpose of develop and offer for the purchase of a real or personal property pursuant to Minnesota Statute 13D.05 subdivision 3C3. With that, I will take a motion to go into closed session.
Make the motion.
Second.
Motion been made, Commissioner Glenn. Commissioner Abbey, second by Commissioner Glenn. All those in favor, signify by saying aye. Aye. All same sign. We are now going to close